Happy birthday, everyone. Welcome to Medicare 101. Who's turning 65 today? Anybody? You're not turning 65. Who's turning 65 within the next couple of months? No? June? Okay, very good. Who has questions and concerns about Medicare? Anybody? You? You? Everybody does, right? So, my name is James Donnelly. I started doing Medicare about 7 years ago. I worked with Northwestern Mutual 7 years ago. I was the insurance guy. My grandmother fell. She broke her hip. She went into a skilled nursing facility. And when she moved into that skilled nursing facility, they switched her Medicare plan. My family called me in panic because they didn't know what was going on. I knew nothing about Medicare 7 years ago, not a thing. I reached out to a friend. He explained it to me as best as he could, and it was very confusing. So I got certified. I got licensed to do Medicare, and I started working with all my clients, and then I started doing seminars like these, and that's why I do seminars like these, to educate. It's not a sales thing, it's an education thing. So that's how I got into Medicare. I'm a local guy. This is my family. I grew up in Oceanside, really Baldwin, Oceanside mailing address. This is my family right here. That's my wife. These are my daughters. That's my granddaughter. That's my 18-year-old and now 19-year-old when she graduated last June from high school. This is my family. This is my mom, my dad, my sister. I grew up in Baldwin. I went to St. Christopher's. I grew up on Long Island. So this is me. These are some of the things that I do: Medicare, health insurance, dental vision plans, accident, cancer, hospitalization plans, life insurance, and annuities. I do mostly Medicare. 95% of my business is Medicare because I love helping people. I hear stories every day about some crazy things that go on. Has anybody seen these commercials? Yep? Okay. Don't call that number, all right? I know it's Joe Namath or J.J. Walker. I think Alex Trebek has got one, actually. But they're lead grabs. So what happens is when you call those 800 numbers, right? You're not calling Medicare. You're not calling any United Healthcare, Humana, WellCare. You're calling a lead company. And what they're going to do is they're going to transfer your call to the highest bidder. That's how it works, all right? And then when they transfer your call, they're selling your information to everybody else. So that's why your phone rings over and over and over again. I mean, it's ridiculous, these telemarketers. It's always, and I put myself on lists just to see what my clients have to deal with, and it's really disgusting. This demographic, 65 plus, is the most targeted demographic for fraud in the world, really, globally. You guys are the most targeted demographic. So block those spam callers. Don't speak to anybody on the phone, all right? A lot of times there's fraud, all right? I have any retired teachers in the room or any teachers in the room? Yeah, okay. So New City, okay. So you have night shift? Perfect. So I spoke to a teacher the other day. She called me. Somebody called her and said that they were from Medicare. Did they know about this benefit, this dental benefit? And she said, no, I had no idea. They said, well, are you interested? She said, yes. Now the call is being recorded. Yes, could you verify your Medicare number? She verified the Medicare number. It was not Medicare. It was somebody who was selling her a Humana plan. So what happens when you switch out a night shift?
You never go back.
You can never go back. So here, this woman worked her whole life for a benefit. All right? Yeah, it's the truth. So now she's stuck. Now, legally, if we were to enroll somebody on the phone, we have to record that call. That call has to be recorded. Legally, we have to send you a digital scope of appointment if we're going to do it over the phone, 48 hours before we enroll you. So there all has to be records of that. But what happens is these agents are calling from call centers, and it's very difficult to track those things. So nobody is doing those things. So be very, very careful answering your phone, even saying yes, verifying your date of birth, anything like that. Has anybody heard of AI, artificial intelligence?
Oh, yeah.
All right. So they're capturing your voice. You ever answer the phone and nobody's there? And you're like, hello, hello. they're recording your voice. Who's eligible for Medicare? Does anybody know who's eligible for Medicare? Who's eligible? I'm eligible. Okay. What do you have to do to be eligible for Medicare? 65 and 40 quarters, 10 years. You have to work for 10 years, 40 quarters. All right? So, that's a story of life. So there's ways to get on. If you didn't work 40 quarters, you could pay for Part A, and we're going to go through that. But what are some qualifying events to open up that door for Medicare? You have to be turning 65, right? You have to be on disability, permanent disability for 24 months, and then they'll automatically enroll you in Medicare. How do you enroll in Medicare? Does anybody know how to enroll in Medicare? Online. Okay. So you could go to socialsecurity.gov, right? If you're not on Social Security already, you go on SSA.gov and do your application. Or if you're already collecting Social Security, you will be automatically enrolled, all right? You will be auto-enrolled if you're already on Social Security. So you could also call 1-800-MEDICARE or Social Security hotline, or you could call me, come to my office, I could come to your home. I do not charge. I could walk you through the process. We could do it together. All right, so this is what we just talked about. Social Security, you can enroll yourself. Takes about 10 minutes, all right? There's two tricky questions. One question silly, I think. It says, are you already enrolled in Medicare under somebody else's Social Security number? Always put no to that, even if you are. Just put no, because otherwise you're going to open up a big can of worms. All right, now, whose birthday's on the 1st of the month? Anybody 1st of the month? You are, okay. Is it really? What's your birthday? He looks good for 60. March 1st. All right, awesome. So you will be eligible for Medicare February 1st, all right? So if you have a birthday on the 1st, you're eligible a full month ahead of time, all right? Otherwise, no matter when your birthday is in the month, you're going to be eligible on the first day of that month for Medicare. Everybody got that? Okay. Now, so a lot of people come to me and they already enrolled in Part A because they turned 65, but they're still working, all right? You don't have to enroll in Part A. You do not, okay? It's a fallacy. They say you're gonna get a penalty, all right? In some circumstances, you do have to, but in most circumstances, you don't. Now, the negative to enrolling in Part A and not really using Medicare is that first year that you're on Medicare, you have flexibility. You could try different plans. You could do whatever you want. You could try a Medicare Advantage plan. You could try a Medicare supplement plan and a prescription drug plan. You could switch and wane and wax any way you want just to try it out because you're new to Medicare. But day one that you activate and enroll in Part A, that window closes. So if you have Part A for a year and then you go on Part B after you retire, you don't have that flexibility. You have to wait for an election window, which we're going to get to. So things to consider. Group coverage versus Medicare. Most people work past 65 now. Most people do. I mean, we have to in this day and age, right? So let's say you have group coverage and you're eligible for Medicare. We could make an appointment, we could sit down, and we could figure out what makes sense, right? Because a lot of times, if you're contributing to your group plan, it might be cheaper to go on Medicare. I had a gentleman that was paying $685 a month for his group health insurance. He was paying $685 a month. And he came to a seminar, and I tell everybody, don't do anything until we sit down and talk. Well, he came to me, he made an appointment, he was so excited. He had his red, white, and blue card. And he said, James, I signed up for Medicare. I'm going to save $685 a month. I said, Tony, why did you do that? I said to wait for me. I'm going to save all this money. Well, we sat down, and he could have saved a lot of money. But his medication, he didn't weigh in his medication costs. Because his group coverage covered all of his medications. Medicare formularies for medication are completely different than group coverage and individual coverage. So his drug cost would have been like $1,800 a month on Medicare. He turned white, he freaked out, he said, and he ran out of my office. He said, I'm going to Social Security now to suspend my Medicare because I can't afford this, all right? This was before the law changed last year, but we'll get into that. As we sit down, we'll review all of your drugs, your medication, make sure that we're on the best plan, whether it's group or Medicare. Why make a decision until you know all the facts? All right, does anybody know how much Medicare is? It's free, right? No, it's not. How much is it? You seem to, nothing's free. I mean, you paid into it your whole life, right?
Less than 200 a month.
So,
Your adjusted gross income.
Irma, yes, exactly. So a couple things. Part A, let's break it down to Part A. Part A is free if you've worked 40 quarters, right? If you've worked 30 to 39 quarters, it's $285 a month. If you worked 30 to 39 quarters, it's $285 a month. And if you worked less than 30 quarters, it's $518 a month, all right? So a lot of people come to me and they don't have 40 quarters yet. If they can afford the premium, you know, then they could go on Medicare. If not, they just tell them to work a little bit longer and then they can. All right. Part A covers everything, right? Your hospitalization. Your hospitalization is free, right? Because you have Part A? No. So, $1,676 is your deductible. $1,676 is your Part A deductible. So the moment you walk into that hospital, you're responsible for $1,676, all right? Per 60 days. Per 60 days. So if you're going in January, you're responsible for the first $1,676. If you go again in March, you're responsible for $1,676 again. Something tragic happens, you're there over 60 days, these are your co-payments for Part A. $419 a day, 61 through days 90. $838 a day, days 91 through 150. And anything over 150, you have no hospitalization coverage, all right? It's pretty scary, right, those numbers? All right, so Medicare Part B. Basic premium, $185 a month. This premium is based off of your income from 2 years prior. So if you're on Medicare in 2025, it's based off of your 2023 adjusted gross income, all right? So this is what it could be, right here. 106 or less, 185, 106 to 133, 259 a month, 133 to 167, 370 a month.
I didn't work 2 years ago.
So then it's 185. Everybody pays 185. Yes? It does. Every year it changes. So every year it changes and they know how much you make and they do it automatically because when you owe them money, they take it right away. But when they owe you money, they're very slow paying. So, so I had a client, retired, Social Security, they had an IRA. They wanted to travel the country. They bought a motorhome. They took the money out of their IRA. $300,000, motorhomes are expensive. I didn't realize that. You just bought one. $300,000. So out of their retirement account. Now that counts as income. They didn't take it all out of it. They took $300,000 out to buy this RV. What was their premium? What was their Medicare premium? $370 per individual. $740 a month. Well, I'm going in now time, but this was 2 years ago. But yeah, so that's what it would be. So talk with your accountants, kind of demise a tax strategy where you're able to access income or your retirement without kind of having it count as income, all right? Because it could get expensive. Medicare premiums, if you're on Social Security, your Medicare premiums will come right out of your Social Security, directly, right out of your Social Security. If you're not on Social Security, what happens? Does anybody know? They send you a bill. Don't freak out. It's going to be a big bill. It's going to be a quarterly bill. They're going to send you a quarterly bill. You do not have to pay that bill in full. You could pay it monthly, all right? And if you had any questions or concerns, you could reach out to me. We could log on to Medicare.gov and set you up on, monthly withdrawals, all right? But it gets a little scary when you see that bill, especially you're retired, it gets a little scary. All right, so what are the gaps in Part B, your medical coverage? What are the gaps? right here. You have a $257 deductible every year. Everybody has a $257 Part B deductible. It only pays 80% of your medical costs, Part B. You're responsible for 20%, all right? So those, again, could be scary numbers. Has anybody heard of an excess charge, a Medicare excess charge? No? So there's a book, I'm sure it's a PDF version now, and they have Medicare rates. So if you break your arm, the Medicare allowable rate is $1,000. Doctors are allowed to charge you 15% more than the Medicare allowable rate. So you would be responsible for that excess charge. There is no stop loss, so it could go on and on and on and on. So there are a lot of gaps in Medicare, all right? How do we fill those gaps? Does anybody know? Secondary insurance. So there's two roads that you can go down once you go on Medicare, right? You could get a supplement, a Medigap plan, and then you're going to need Part D, a prescription drug plan, and there's a Medicare Advantage plan. So there's two routes that you can go. So we're going to talk about a supplement plan right now. There are advantages, there are disadvantages to both, okay? So with the original Medicare and a supplement, you could go to any doctor, any hospital in the country as long as they accept Medicare. No referrals, no prior authorizations. You could walk in and say, bam, I'm here, I want to see a doctor, and they have to take you, okay? So that's a luxury. These are the different supplements. It's Alphabet City here, all right? Most of the time, we'll work with Plan G and Plan N. So this is everything that a Plan G will kind of fill in, all right? It covers excess charges. It covers your 20%, covers your Part A deductible, your Part A coinsurance. It covers everything except for your Part B, deductible, which is $257. This is your cost for a supplement, all right? So these are the 4 different companies that offer supplement plans on Long Island. AARP, everyone's heard of AARP, right? Yep. Globe Life, Humana, and Mutual of Omaha. So $324.75 for Plan G with United Healthcare, $366 for Globe, $605 for Humana, and $509 for Mutual of Omaha. It's the same plan, okay? It's the same exact plan. A Plan G, a Plan N, a Plan L, a Plan K, a Plan F. It's the same exact plan. There is no difference. It's regulated by Medicare. It's the same plan. But companies could charge you whatever they want. So the most economical, the cheapest one in New York is United Healthcare. There is not much of a difference as far as supplements. An N, I like N's, I like G's. So I like N's and I like G's. The difference between an N, it's a little cheaper than a G. It's $246 a month, all right? You do have a $20 copayment when you go to the doctor, and it does not cover your excess charges. So that's the only difference between an N and a G, all right? Now in some states, New York being one of them, doctors are not allowed to charge excess charges. New York, Connecticut, Rhode Island, there's 5 states in the country that are not allowed to charge excess charges. It's a state regulation. So when can you review your plan? When could you switch your plan? Does anybody know? October 15th through December 7th. That's your annual election period, all right? And you could also review your drug plan. Yeah, that's when that's when I sit down with my clients and review their Medicare plan every single year. We're going to have a date, and we're going to make sure that you're on the right plan. These are some drug plans, and let's go back to this because prescription drug plans are very important. Every year, prescription drug plans change, all right? And the reason we went from a supplement plan to a prescription drug plan is because you need a prescription drug plan. By law, all right, if you're on Medicare, you need a prescription drug plan. Otherwise, there's going to be a penalty, all right? So does anyone know what that penalty is for not having Part D? It's 1% a month for every month you did not have Part D. Now, my mother-in-law didn't have Part D for 10 years. So it's 120% higher, her drug plan, than it would normally be because she didn't have it. The formularies on prescription drug plans change every year. They change every year. They take drugs out, they put new drugs in, they drop insulins. So yes, insulin is now $35, right? But not every insulin. It's whichever one the insurance company wants. So that's why it's so important to sit down and review your plan every single year. If you don't switch it during AEP, you're stuck on that plan for a year. No matter what your diagnosis is in February, if you have to go on an expensive drug and it's not on the plan, you're stuck on that plan that you're in. So it's very important. So now everybody has a max out of pocket for drugs, $2,000. So you cannot spend more than $2,000 on medication in a said year, all right? And if you do, it's free. The medication's free. Now the insurance companies were freaking out because it was $8,000, now it's $2,000. So this past AEP, October to December, was chaos. They changed all the plans, they raised premiums. There was a plan for $3.70 a month, it's now $43 a month, a drug plan. But what they did was they dropped drugs from the formulary because the law states it only counts towards your max out of pocket if the drugs are in the formulary. If the drugs are not in the formulary, you're responsible the entire year for your drug costs. So I sat down with my clients, I was on the phone with doctors' offices trying to find alternatives to their drugs because they weren't on any of the formularies. So it was a crazy AEP, but that's what you get. Like when you work with me or my team, like we'll sit down with you, we'll make sure, we'll find alternatives, we'll speak to doctors, we'll try to do formulary exemptions, like where we're applying to the drug company saying, hey, listen, we need to be on this medication for X, Y, and Z. We've tried every other one, it doesn't work. But that's what you get when you work with us at Safe Haven, because we truly care, we want the best. Now, remember that adjusted gross income that we were talking about? For making a little too much money, you get kind of penalized. The same thing happens with your drug plan. All right, so you have your Part D IRMA, all right? So if you made more, so it's going to be whatever your drug plan is, plus $13, plus $35, plus $57, plus $78, plus $85, depending on your income. If you made less than $106,000, you just pay your premium. Any questions so far about prescription drugs? No? All right. We spoke about delayed enrollment fee. I told you that.
James, quick question.
Mm-hmm.
The 106,000 you refer, is that couple? Or
No, that's single, right here. So joint is 212. Yeah.
Thank you.
You're welcome. And if you file married separate, you kind of penalize for that. Like you don't, it goes as an individual, so it's kind of hairy. These are all the different drug companies, all the different plans here. I mean, there's a lot. There's a lot of drug plans. So that's why when we work with you, we sit down, we put all your medications in, and we look at every single company, every single plan that you're eligible for, because that's what we do. And we want to make sure you're on the right plan.